goals of CPR are several. Mainly what you want to do is get air into the lungs and then maintain blood flow to the heart and brain. Additionally, if you can maintain blood flow to the heart will be able to restore to a normal rhythm, and then blood will circulate, the output of the heart will be good, and get the body going so that you can alleviate the tissue hypoxia, which is the lack of oxygen to the tissues of the body. And also the byproducts of that hypoxia are carbon dioxide, which causes acidosis in the tissue. Now, just as in what's taught by the Red Cross, we go by the ABCs. Very easy to remember. This is the order in which you perform. The CPR is A for assessment and establishment of the airway, and B is for breathing support, and C is for circulatory support. Next. So what is in the assessment? It'll take me about 10 minutes to go through this assessment, but it should take you about 10 seconds to do. And I would encourage everybody to go home and try these different things on their dog as far as these eye reflexes and pulses, and see what it's like on a normal dog so you're familiar with it. Starting, the first thing is, if you have a dog keel over, you come up on a dog and you're wondering whether it's dead or whether there's a chance that you can save it. Does it need to have CPR? The first thing you want to do is look at his eye reflexes. There are 2 eye reflexes that are very easy to do. Next. The first is called the palpebral reflex. With this, you just lightly touch the corner of the dog's eye or brush your fingertips over his lid at lashes, and the dog will blink. If the dog blinks, then it is, to an extent, conscious and feeling pain. It may not be able to get up, but it is feeling pain, and it does not need to be resuscitated. It's not in that situation. Next slide. So say that it doesn't blink. Then you can go and check the next reflex, which is the corneal reflex. If it has a blink reflex, you don't need to do the corneal reflex because you know it's got one. The corneal reflex is where you actually touch the cornea of the eye very lightly. You can do this with your mitten on. You don't have to use your bare finger. And if the animal should blink, it might be a little bit slow and sluggish if the animal has just recently stopped breathing. But if the animal is in dire straits, it's not going to blink at all. And that is not a good sign, but it means that you need to do something immediately. Next. So after you decided whether the animal is conscious and or feeling pain, if it is not, then you want to watch and see if the animal is breathing. At the same time that you're looking to see whether it's breathing, you can be checking the femoral pulse. Next slide. Excuse me, let's back up one. I jumped ahead of myself. While you're up here at the face and you've assessed whether the animal is breathing or not, and assuming that it's not breathing because you're going to need to proceed with your assessment, you're going to look at the gum color. And there are several different things that you might see. Hopefully the gum is nice and pink, and that means the animal's oxygenated. If it is bright brick red, then the animal may have carbon monoxide poisoning or cyanide poisoning. The other colors that you can see are kind of a ruddy, muddy color. That usually is when the animal is not circulating well, is on his way out, or in some kind of shock. And if it's blue, then you know you're going to have to do CPR because the animal is not oxygenating at all. And the other thing that you can do is called a CRT, or capillary refill time. Next slide. And this is where you press your finger on the gum, just above the gum line, or on the inside of the lip, and it'll blanch white. Next slide. It'll blanch white for just an instant and then go back to the pink or whatever color it was. It should return in about 1 or 2 seconds. If it takes longer than 2 seconds, then the animal's circulation is impaired and it's in trouble. They actually still have a CRT after the animal is dead, but it takes about 4 seconds. Next. Okay, so we've looked at the eye reflexes, we've looked at the gum color, we've assessed whether the animal's breathing or not. It's not breathing, so we're going to palpate for a femoral pulse. And you can show the next slide. The femoral artery is the easiest one to palpate on a dog, the most accessible. And please try this on your dog at home so you know what it feels like if you haven't already taken a pulse before. It is right on the inside of the thigh. You don't have to press very hard. It's right in between the 2 big muscle bundles. And you can either palpate it this way or the next slide. I have my thumb over the top, but I'm still palpating with my fingers. So now if the animal does not have a pulse, we're going to check to see if the heart is beating at all. So next slide. you can, next slide, you can just palpate the chest and put your hand right over where the heart is. Now obviously this animal's conscious, so it does have a heartbeat. If it's looking at you, it's got a heartbeat. I have a story with that, but I've decided to leave that out. But actually, yeah, if they're conscious, their heart's beating. And so you just put your hand over the heart. And why do you do this? Well, because you can actually feel what the heart is doing. When an animal first goes into cardiopulmonary arrest, its heart may actually just be fibrillating. And that kind of feels like kind of a vibration in the chest. If you can catch the animal before the heart has actually completely stopped and still fibrillating, you have a better chance of being able to revive it. Next slide. So, in assessing the airway, if you haven't already done it, you should cut the neckline if this is in the team. I'm assuming that if the animal had the neckline or the gangline wrapped around its neck, you would have cut that instantly before you did any of the other assessment. That goes without saying. But if you haven't cut the neckline, at this point, either unhook it or cut it if you have to, just so that the team doesn't take off on, dragging you and the dog or pulling on it while you're trying to resuscitate the dog. Then you want to open the dog's mouth and look and see if there's an obstruction. It is quite common to get bones, especially things like rawhide or rubber balls caught in the throat. The dog might have picked up in vigorously eating and inhaling his food, might have gotten something lodged in his throat, so you want to check and make sure that there isn't anything there. If there is, pull it out with your hand. If the dog is in respiratory arrest, its jaws are going to be flaccid and its mouth is going to be very easy to open. If the dog's mouth is not easy to open, it's either been dead for a long time and is in rigor, or it's having a seizure, in which case it does not need CPR. Next. So how do you give mouth-to-nose ventilatory support? First thing you do is hold the dog's mouth closed, you don't want to hold the nose closed. And you want to try to keep the dog's head down, because if there is any blood flow, and you're hoping that there is, you want to have the brain lower than the heart so that blood can get to the brain, because the most important thing here is that you get blood flow to the brain. You place your mouth over the dog's nose and the end of the muzzle, next slide, like this, and you blow into the nose, so it's mouth to nose. Next slide. So what do? You give 2 long breaths. This is how you start, with 2 long breaths about 1 to 1.5 seconds in length. Then you turn and look at the dog's chest and see if it starts breathing. If the dog has just been choked and you've removed whatever's choking it, if you're right there, they'll start breathing right away. It doesn't take much to get them kick-started. So you observe for about 5 to 8 seconds, see if they're breathing. If they have not started breathing, then you go ahead and give more mouth-to-nose ventilations at about the rate of 20 per minute. Next slide. Okay, at this point, what you do next depends on whether their heart had stopped or not. So right here, I'm giving ventilations in a dog that still has a pulse, and I've got my hand on the femoral artery so that I can continue to palpate the pulse while I'm trying to get the animal breathing, because it is possible that his heart would stop while I was ventilating if I was being ineffective. You could also just put your hand on the heart while you're doing the ventilations. So next slide. Assuming that there is no pulse, or the pulse slows down and stops while you're palpating it, you want to start with the external chest compressions. So you give those first 2 long breaths, and then you get ready to do the chest compressions. The positioning for this is to have the dog lying on his right side, again having the head lower than the body if that's feasible, so that blood flow will be maximized to the brain. And you need something to push against. So in a very small dog, your left hand is going to be under the chest, and if it's a larger dog, you're going to want to shove some snow. Next slide. Shove some snow underneath the chest, or anything you can get a hold of. If you're in the house, throw a towel or a pillow, or hopefully it would be a stiff pillow, something underneath the chest to support it. Next slide. So again, in a small dog, you're going to have your left hand underneath the chest. In a larger dog, you're going to have both hands on top of the chest, and this is over the area of the heart. So it's right behind the elbow at the widest part of the chest. And you're going to spread your fingers because you want your hands to be wide. You do not put them hand over hand like you would on a person. You want them spread out. Next slide. So this would be the positioning on a small dog. So with the elbow bent, that is where the left ventricle of the heart is. Next slide. On a large dog, you're going to have both hands over the heart, the back part of the chest, and so it's kind of on the bottom half of the chest behind the elbow. Next slide. If you're going to make an error in your positioning, be too far back and not too far forward, because if you're too far towards the front part of the heart, you won't have effective blood flow. One thing I want everybody to understand is you're not pumping the dog's heart. That's not what you're trying to achieve here. The only time you can actually squeeze the heart is in a very tiny puppy, like a 5-pound or smaller puppy or a cat. You're not squeezing the heart. What you're doing is creating pressure within the chest and driving what's called the thoracic pump. So that's why you want your hands spread wide, because you're going to be increasing the pressure inside the chest, which is going to collapse the veins that drain blood into the chest so the blood flow doesn't go backwards, and it's going to force the blood forward through the aorta to the brain, cardiac arteries, and kidneys. Next slide. So you've got your hands in position. What do? You want to give a sharp acceleration, and you're going to depress the chest about 1 to 1.5 inches, assuming this is your average size sled dog. It varies, of course, for the size of the animal. So what I would say is you don't want to depress any more than 1/3 of the chest volume. So you're going to give a very sharp acceleration, pressing and releasing. Now this is where I want to add some real cautions. In cases that I have seen, overzealous, vigorous attempts at CPR have actually caused the animal's death. If you fracture ribs, there are major consequences. It will decrease your ability to create this pressure wave, so you won't be able to move blood forward. If the heart is going and you were doing CPR and you didn't need to, or that your CPR worked and you got the heart going but you broke a rib, you're going to cause possibly arteries to be lacerated, such as the ones that run along the ribs or the aorta, or even puncture the heart. And if you got the heart going, then the animal will proceed to bleed to death before you can do anything about it. So it is important not to overdo it. And you're going to have an adrenaline rush, you're going to be excited, just don't push too hard. So try to achieve just less than 1/3 of the chest distance being compressed. Next slide. So again, the hand positioning, and you want to kind of be pushing towards the opposite shoulder. So the direction is kind of down and up a little bit. So you're in the lower half of the chest, back behind the elbow towards the widest part of the chest, hands spread. Next slide. What is the rate? The rate should be about 80 to 100 compressions per minute. This is a lot faster than you would do in a person. And I know you might say, oh, well, sled dogs have a lot slower heart rate. Well, we're not trying to achieve a normal heart rate here. We are not as effective at moving blood as the normal heart pumping mechanism. We're trying to make up for that, so we're going to go a little bit faster. Now, again, if you try to achieve about 1 to 2 compressions per second, it'll get you in this range. It'll be okay, because you're going to be excited and you're going to be pumping faster than you think, just like I'm talking faster than I want to. More important than the rate is to get this compression and relaxation ratio to about 50%. You're trying to drive this thoracic pump, so if you're going to drive the pump forward, you need time for the pump to fill back up. So there needs to be time for blood to flow back into the heart and into the vessels of the chest so that you can push it forward into the brain. So it needs to be about 50-50. So for when you give your sharp acceleration, you want to release to allow blood to flow back in. Next. If you're by yourself, you've got to do both jobs on your own. The important numbers to remember are 5 to 1, 5 compressions for each breath. So you give your 5 chest compressions, and then you give 1 breath. Don't pick the head real high up. Go down to the head, trying to keep that brain lower than the heart. Give a breath, go back to the chest, give 5 compressions. Keep this up, and what I would suggest is checking the pulse about every 4 or 5 cycles to see if you've got the heart kick started again. Of course, if the animal starts breathing and fighting you, then you've done a good job, and you know that the heart has started, because if the animal's breathing, the heart is going. As you're checking periodically for the pulse, when the pulse comes back, then you want to just continue with the respirations at about 20 per minute until the animal starts breathing again. And also in between, say you've got the heart started and you're just doing the ventilations, periodically check the gum color and see that it's coming back to pink. If it's still blue, you got the heart going for a moment, then you probably still got an obstruction in the throat. And you want to try to look again and see if there's something that you can remove because you're not getting the oxygen effectively into the lungs. Now there might be an injury that you can't do anything about. If the neck was lacerated because of a dog fight or something, you may be able to put your hand over the holes in the trachea, but you want to check the gum color to see whether you're being effective or not. Next. If you're fortunate enough not to be alone and there's a second person there to help you, one person can do the ventilations and the other person can do the compressions. You want to try to coordinate this so that the person who's doing the compression is counting out loud, and the person giving the ventilations can inflate the chest and hold it during some of those compressions, because during the inflation phase, when the compression is done, it will increase the thoracic pressure even more and have a more effective driving of this thoracic pump. If you're really fortunate, and there are 3 people there, get that third person to do abdominal compressions during the relaxation of the chest compression, and this will pump blood, help move blood into the thoracic pump so it can get oxygenated and go to the heart and the brain. This third person can also be checking the pulse while the person is compressing the chest, and they should be able to feel a pulse. It'll be weaker than a normal pulse, but if they're doing the chest compressions effectively, they should be able to palpate a pulse. If you're doing it by yourself, you can't give a compression and feel the pulse at the same time. Next slide. So everything has gone great. You've brought this animal back to life. You're having a major adrenaline rush because you feel like God. And it is one of the most exciting things I've ever had, is bringing an animal back around. So what are the consequences now? Well, you have all the consequences of the original disease or cause of the animal having arrested. In a case of something like a choke, there isn't a whole lot of consequence of the injury itself except for maybe some swelling in the throat. But there are consequences because of that lack of blood flow that occurred to the brain, the kidneys, and the heart. Some of these we can prevent the damage from occurring if the animal gets immediate treatment. So just because you brought the animal around and it's waking up, it's breathing, and eventually it's going to get up, it still needs to be treated by a veterinarian because there are medications and also fluids that we can give to prevent these other consequences. 1 or 2 days down the road, the animal can go into acute renal failure because the kidneys do not like to be starved of oxygen for very long. So we can alleviate this with fluid therapy. The other really major consequence is neurological impairment. Quite frequently, when animals are resuscitated, afterwards they're blind. If they are blind, there's nothing we can do about it, but we can try to prevent that from occurring by giving dexamethasone and other drugs to try to prevent the brain from swelling hours down the road. Also, the heart doesn't like to be starved of oxygen, so during that point when the heart was not getting good blood flow, it can cause damage to the heart muscle, and that can cause heart arrhythmias that can be treated with medications in some cases. If you're a little bit overly vigorous with your resuscitation attempt, you can cause bruises in the lungs, pulmonary contusions, and these need to be treated. So again, it's important that post-resuscitation you get the dog to the checkpoint or get the dog to the veterinarian to be treated. Next. When not to perform CPR. This is very important because like I said before, I have seen dogs die from CPR who didn't need it. An animal that's knocked unconscious, he's unconscious but he's breathing and his heart is beating. Somebody pumps on his chest too hard, and a big 180-pound person who's got their hands doubled over, throwing all their weight on the dog, as is kind of shown in doing humans, is going to break ribs, and the animal can bleed to death. So we don't want to overdo it. So if the animal is unconscious, it's breathing, and it has a pulse, do not do CPR. And I've seen it done, so I just want to repeat that, even though it sounds like it's intuitive. Don't do CPR if his heart is beating. Now, if the animal's unconscious, he's not breathing, but he does have a pulse, then all you need to do is give the ventilations at about 20 per minute, mouth to nose as we described. And lastly, the more confusing situation is when you come upon an animal that's seizuring, because seizures in some ways look quite a bit like agonal movements, and agonal movements are what we see at the moment that an animal dies. Next slide. So I want to help you distinguish between watching an animal in its very last moment as it dies and an animal that's having a seizure. Because the one that's having a seizure, you want to leave it alone. You don't want it to, hurt itself on anything, but you don't want to do CPR on it. the one who's in his agonal movement, you're right there at the prime opportunity. Depending on what the cause is, you have a good chance of resuscitating that animal. The big one here, I should have put it on the top, is that the seizuring animal is going to have a pulse. The agonal animal is not going to have a pulse because the agonal movement occurs right after the heart stops. But several things happen. When an animal goes into the last death throw, what they do is they stretch their legs out and put their head back. It's not like on television where somebody closes their eye and goes to sleep. Almost always you'll have this stretching of the limbs and the throwing of the head back. It looks very similar to a seizure. Seizures don't have to have this pawing or any kind of jerking. They can be a stretching type tonic muscle movement. Also, in a seizure, the eye reflexes that I was telling you about will still be there. You'll still get a blink, you'll still get a corneal reflex, but you will not have eye reflexes present in the dog that's agonal. In a seizure, the eye rolls down and the white of the eye appears quite prominently, but in an agonal movement, the pupil dilates and fixes very quickly. Within about 45 seconds of when the heart stops, the pupil will be fixed. That doesn't mean you won't be able to bring them back, though. Also, in a seizure, the animal will be breathing very irregularly, kind of like gasping, which is very similar to the agonal movement. An animal will take a couple of breaths even after the heart has stopped. So usually what happens is if the animal goes into respiratory arrest, after about 2 or 3 minutes the heart stops, and then it will take 1 or 2 more breaths after it is actually technically dead. And they're usually a very deep inhalation and then this kind of slow exhalation. But again, that's the point where you can still perform CPR. And also seizure animals, if the animal has a history that it's an epileptic or it has a seizure disorder, you're more likely to think that it's having a seizure and just check for the pulse and the eye reflexes so you know whether it needs CPR. Next. So what is the success rate going to be? If you have one of the causes, such as choke or suffocation, drowning, foreign body obstruction, and the animal has just gone into respiratory arrest, and you get to it within that 2-3 minute window and give it respiratory ventilations, you are very likely to recover that animal, to get it breathing again and have it survive. It happened in my own backyard. I had a puppy out on the chain for its first night, and the chain was too long, and he and his sister wrapped around each other and choked. The one dog choked because the other dogs were screaming. Went outside, found the dog was blue, heart was really slowing down, cut the collar off, and just through about 2 minutes of ventilations, the animal survived. So you can do it as a practical thing. As far as the full cardiopulmonary arrest, I don't want to kid you that it's like easy, because the chances of the animal recovering completely are not very good. But for that 1 in 10 that will survive, it's worth knowing how to do it and worth trying to do it and worth doing it right. But they have found in research that the survival rate of animals that go into arrest, cardiopulmonary arrest in a hospital situation, only about 10% ever leave the hospital alive. Quite a few of those are resuscitated, but within hours or days they die of the other consequences that I was discussing. Next slide. 2 last things. In the case where you're not successful and the animal dies, please consider having a necropsy done. And this is for several reasons, and not just because I'm a pathologist. But it will help your peace of mind knowing what happened. If it turns out to be cancer or some other underlying disease, it will really help your peace of mind to know why this has happened. Also, you can find out how effective your CPR was or not. And if there is some underlying disease, genetic or nutritional, that's in your kennel or in your line, you can find out about this and maybe prevent other dogs from suffering the same fate. Excuse me. And lastly is for research. Some diseases are very uncommon, and for us to learn about them, we need to have cases that we can examine. For example, sled dog myopathy. This is very, very rare. And the only cases we've seen, except for one, have occurred on races. And this is because not very many sled dogs come to necropsy unless they have to, because they died on a race. So if a dog dies suddenly in training, it is very important to have that dog necropsied so we can learn more about these rare conditions and find out what causes them. And one very last thing that I wanted to mention. I'm on an internet discussion group of veterinary toxicologists, and I just learned this week about a case in a kennel in South Dakota where the main I don't know what breed it was, but their main stud dog died suddenly, and several of the other dogs became sick. And during necropsy, they found that the dog had eaten the polyfoam sealant that was used to seal up the cracks inside his kennel. And this is that canned stuff that you get at Fred Meyer's that you can seal up the cracks in your windows. It seems like it would be a very innocuous thing once it's dried, but it's not. When it is swallowed by a dog and combines with the acid in the stomach, it releases a very toxic substance that will destroy the liver and cause permanent kidney damage if the dog doesn't die. So I just wanted to let everybody know to make sure that nobody uses this spray foam sealant anywhere a dog could get a hold of it. Any questions? Allison? What they can do is, the first thing they should do is call their regular veterinarian. And that veterinarian will decide whether it is a situation that they can handle themselves and do the necropsy, or if they want to bring in a pathologist or have it done at the university. And all the veterinarians in the area know how to get in touch with us and how to get the animal to us. So they should contact their regular veterinarian. Usually, we do it at a very reduced cost for these kinds of cases. We usually try to work something out where we just have them pay for the cost of additional diagnostic tests or equipment that we have to use. And quite often, I usually just donate my time because I'm interested in finding out what's going on also. So it isn't really that expensive. There's usually some expense involved, but it's not very great. Ken?
One thing I remember for humans you are terribly exhausted to do, and you can't do it for very long. And so the follow-up to that is, so how long can you do it on a dog? The follow-up to that would be, how long should you do it? When do you just say, all right?
Yeah, I was thinking about that, and I should have said, if you haven't gotten the heart started, or let's go for, if both the heart and the breathing have stopped, 10 minutes. If you haven't got the heart going, the brain is fried at that point. There probably is no chance of getting a recoverable animal after that. So you're going to be really exhausted by 10 minutes. If the animal is in respiratory arrest and there's still a pulse there, I would go as long as I could until I could get help, because that animal has more of a chance. And if the heart continues to beat while you're giving ventilations, the fact that the heart's still beating means you're getting some oxygen to that heart. And it's a lot less work just giving ventilations than the chest compressions. So it kind of depends on the situation as to how close help is. If the vet clinic is like 2 doors down and you can get there in less than 2 minutes, that's quite a bit different situation to when you're out on the trail by yourself. But 10, 15 minutes is about, I wouldn't go any longer than that. Yes?
What happens if you need to Heimlich the dog? Did you go over that briefly if you don't?
Yeah, you can do it very similarly to what I was talking about, the abdominal compressions, where you put 2 hands on the abdomen and you can thrust forward. I mean, it's kind of hard to hold a dog like you would a human being for a Heimlich maneuver, but you could try it. I've never tried that, but if you have a Leatherman tool or something like that, you may be able to reach down and grasp it. It's amazing how wide open you can get a dog's mouth and how far you can shove your hand down there. I was showing my roommate last night, and I went up to her dog, and I just opened his mouth and just went right down there. When the dog's unconscious and his jaws are slack, you can reach down pretty far, and you can see the top of the trachea right in their mouth. It's a lot easier than in a human being. So you should be able to visualize what's blocking there if there's something blocking. If it's gone down into the trachea, you're going to have a much more difficult time, and all I could suggest was giving a sharp thrust on the abdomen forward.
We had last year, we had a blockage, we weren't sure what to do. We ended up straddling the dog, facing its rear end, and then doing the thrust like a bird back up.
Yeah, did that work? Yeah.
If the dog wasn't unconscious, you're getting a high-pitched whistle.
Yeah.
Like you get first, and that's about 7 or 8.
Yeah.
And that seems to work.
Yeah, I don't know. I've never seen really a written up protocol on how to do a Heimlich maneuver on a dog, but that certainly worked, and that's great. What I described here is what's the current recommendations, and it is written up, and I talked to some people that belong to the American College of Emergency and Veterinary Critical Care Veterinarians to get the latest thing. So, I mean, there's been research on this, but I've never heard about exactly how to do a Heimlich maneuver, but it sounds like you adapted it very well. It worked. Yep.
We've got time here. Could you take a minute to talk about the arrest due to the sled dog myopathy?
Yeah. Yeah, well, like I said, we've only had 11 cases of sled dog myopathy, so we don't know that much about it. But what I can say about it is if the dog keels over because of sled dog myopathy, CPR is not going to work. The problem is that what we believe is when the muscle tissue dies, and we don't know the exact cascade of events that causes this muscle destruction, but when the muscle dies, it releases potassium. There's a lot of potassium in the cells in your body, and the potassium makes the heart stop. So the only way that you would be able to resuscitate a dog that was in that situation was with drugs that you're not going to have, and you're not going to have an IV in, and even then it would be extremely difficult because the animal would be in really bad shape. So that is due to a chemical imbalance, and that's one of the things you wouldn't be able to resuscitate the dog from. So after 10 minutes, you'd give up. But again, we just don't know enough about sled dog myopathy and why it occurs to really address your question. I wish we did, and that's why I would like to have more dogs to necropsy, so I really knew more about it.
Has there been work done on live dogs that have gone through a race to determine if this is a progressive thing in the muscle tissue?
Well, one thing that we did do, not this year but last year, is I went ahead and did muscle biopsies on some dogs who, during a couple different races, including the Iditarod, had torn muscles or had ruptured Achilles tendons, because we believed that this might be a consequence of a mild form of the myopathy, that they hadn't gone, it wasn't so severe that they died, but they caused enough muscle destruction that it caused the muscle to tear. And this was, I came to this because I did see one dog who in a race died 2 days later from myopathy and had a ruptured Achilles tendon. So we went and biopsied some dogs, but we could not find any evidence on the biopsy of myopathy. But it was only like 2 cases that I did. But I believe it is possible. I'd like to look into doing more muscle biopsies on dogs that get dropped from races and see if we can determine whether there is myopathy going on. But there just isn't the money to do it.
Have you put together any anecdotal evidence from mushers where this has happened, and what they look for, or what we should look for as a precursor?
There really isn't enough information or consistency yet. The most consistent thing we get in the history is that the animal suddenly vomits violently, and so violently that we find food particles jammed way up in the sinuses, and then keels over and is dead. So the one most consistent sign really was the vomiting right before they died, just a sudden violent vomit. But I believe there are some dogs that are suffering from more mild cases that do survive.
I don't know if these particular dogs, if it was sled dog myopathy, but in one race we had the occurrence of the dog collapsing, being rested and fed, seemingly to be dead and fine, hooked up around half a mile and keeled over dead, like you're saying. Does that possibly indicate that there's been a slow progressive onset?
That would be consistent with what could happen in a myopathy situation, that they could die a few hours later or even days later if what's released from the muscles when the muscles die, not only potassium but also myoglobin, which damages the kidney, so they can die a day or 2 down the road or even a little bit longer because of kidney damage from these products that are released from the damaged muscles.
Is there a possibility of an onset and then a treatment that would, say, within 36 hours have the dog back to normal and raceable, or is this something that the dog must be dropped?
Well, At this point, I would say that you should drop the dog, but we're not very good in the field at diagnosing this that quickly. What you can do is there is an enzyme test, so a blood test that could be done, but in a race situation, you wouldn't be able to get the test run that fast. But if we had dogs in races or in training and we drew a blood sample and we ran looking at CPK, we would be able to tell whether they were having muscle destruction or not. So that would be another avenue of research that should be pursued, is looking at blood samples. In a normal race situation like the Iditarod, they do have increased levels of CPK, that's been found, but these would be astronomical levels, really way off the scale.
So could you say generally, though, that a dog that has collapsed but not died would be better off being carried?
Absolutely, absolutely. Unless you know why it collapsed, and even if you did know why it collapsed, every one that I can think of has repercussions or consequences that could possibly cost that animal its life. I mean, even if it got, ran into a stick and got knocked unconscious, you should still bag it and not run it once it comes around, because the brain is going to start to swell. So any extra stress you put on that animal is going to increase the chance of there being a secondary collapse and death. Thanks.